How you doing, Dr. Ulysses Jackson? Welcome back to another Mental Health Monday. And everybody that continue to follow me, make sure you hit that like button and subscribe. Today on Mental Health Monday, I'm going to take you down a different road. I'm going to talk about some things that I've heard people say that help them in their life, make positive changes, and some things that I've actually done. So we're going to look at 7 habits that can change your life. And these habits, they start with understanding that the people you hang around with, right, can influence the things that you do. So these people could also add to helping you change your life. So for example, today, marijuana is legal. It's a lot of people smoking marijuana. Nothing wrong with it. Do what you do. But I choose not to smoke marijuana or drink at all. So I'm not going to have them people with me all day long. I know some of my friends where they get stuck sometimes, they're looking crazy, and they kind of slumps. Then it's the other functional person that could actually smoke marijuana all day long and be functional. I don't know too many people that can. So that's not part of my daily routine that I'm with people that just puff pass all day long. Not a problem with that. That influenced my behavior. Back in the days when I did smoke, I was to go to the store, get all the cereal, smoke weed, have my now-a-laters, and just get toasted and just eat and watch cartoons all day. Play video games. Sega Genesis back then. And didn't really work for me. I wasn't productive. So I don't really hang with people that do that all day. Nothing wrong with it again. That may be their habit. That may be a part of their daily life.
It's 4 o'clock.
Places and things I have to be aware of. What are some places and what are some things that I put myself around? See, if I find myself in bars or I find myself in where just things are kind of negative, I got to ask myself, what's the purpose? What am I associating in these areas for? So these are some things, again, and some habits that could change your life. Start looking like, why am I always at the party? If I'm not getting paid to DJ, I'm not performing. Why is my makeup that I'm at every single party all of the time? So I start to be aware of the people, places, and things that I find myself around and it's associating with on a regular basis. Getting out of your comfort zone. I know, again, like I said, I know no other doctors. So it was important for me because in my neighborhood, there was nobody who was an MD or a PhD. So I had to get out of my comfort zone and start associating with men and women that were where I wanted to be, which means I had to talk to people. No, I'm not going to name their name, but I associated with a lot of people. Most of them were women. Most of them were women that were in these PhDs, licensed clinical social workers, mental health counseling. I had to frequent with them a lot and discuss some things with them. And we kind of just built a bond and built a rapport because I had to get out of my comfort zone. My comfort zone was hustling, smoking weed, just, doing me. You know what I'm saying? And when I realized that I could be a doctor and I could do doctor things, I started having to associate with people that was on the path that I want to go on. So I had to get out of my comfort zone of doing my regular, my 1-2-1-2. Then, after I realized that the comfort zone that I was stuck in was the hustling and that same, I always wonder, why do I always go to court? It's a local courthouse out around here in a place called Central Islip. When I used to drive down Carlton Avenue, I would think to myself, I felt strange that I didn't have a court date because my name was on a court calendar for so long that I felt out of place, that I ain't got to go there for a charge. I don't got to go there for a traffic ticket. I don't have to go there for nothing because that became not a part of my life. So I had to stick to something new and get out of the comfort zone. Because if nothing changes, nothing changes. And there were some changes that I was trying to do in my life. So I had to get out of that place of comfort. The next thing that I learned, or the next habit that I had to learn was don't get distracted. Don't get distracted from your goals. See, daily you're going to get constant messages for what to do and what not to do. If you're easily distracted, you have to identify a reasons to take a break from that distraction. You know, 'cause we're trying to form a new habit. It can be something as simple as I'm supposed to be studying for a test, or I'm supposed to do something with my child or my children. I'm supposed to prepare a presentation, and I'm so distracted all the time, and I don't know how to stop these distractions. So I have to be aware there's going to be some distractions that's going to come into my life. How am I going to deal with these distractions? So one of the 7 habits to change was being aware of these habits. This led me to be more of an introvert. Just really allowed me to get comfortable being by myself. The journey that I took, it was a lot of quiet time. It was a lot of times where I was alone. It was a lot of time where it was me in the 4 walls, and I had to ask myself, how bad do I want this? So when you're setting a goal, ask yourself, what's it going to take to accomplish this goal? How bad do I want it? And at the very end, when I was that close to defending my dissertation to get my PhD, I had to ask myself, how bad do you want this? The next thing is understanding the journey. Understanding the journey was, for me, making sure that my goals were realistic. What does a doctor my age make? Can my journey be sustainable? You know, I would hate to get, because I've heard somebody say this in a PhD program. I got an ABD. What's an ABD? You're trying to get a PhD. ABD was all but dissertation. That means you did the coursework, you did everything that you had to do, but you just didn't get that PhD. And I've seen people put that on their resumes that, you know, that they completed all of their PhD work, but they didn't complete the dissertation. So you have to understand the journey and what this is going to entail. Is it realistic? Can I make this goal? Can I make this happen? So once you begin the journey, you evaluate how other people have reached their goals and completed their journey. Say to yourself, is this doable? Next, do yourself a few things, right? Allow you to know that your goals are attainable. And next, try to find out what's going to be the challenges. For me, the challenge was my age, how I was going to feel about other people in my classes, and could I pay for it? Did I have the money to pay for my education? The one thing I didn't want to do was get into my education and find out that I didn't have enough money to complete the PhD program. Next thing I learned out of these 7 habits that helped me change my life was focus on the solution and not the problem. Everywhere I looked around, it was a problem. If I'm problem orientated, I was going to have to ask myself, how can I solve these problems? You know, I just say, what's the problem? You know what I'm saying? So I've heard it once said before by another therapist that for every solution you come up with, a person had another problem to show you. You have to identify these problems and find a way to work through it. You know what I'm saying? If you're a solution-focused person, once the problem becomes too great, then it's going to be harder to find a solution. You know, like even with Mental Health Mondays, in the beginning, before I started, I came up with every reason, every solution. I can't do it. I don't have a studio. I don't have a quiet area. I don't have the time. Who's going to hold the camera? Where am I going to sit down? And every time one of those problems, there was a solution, I came with another problem. So understand and focus on the solution to getting to your goal, and don't focus on the problem. Next, in the journey, never forget to stop and take out that R&R. Remember, set a time aside in your week. Calm down. Get away. Set some goals. Take a break for some rest and relaxation. because you don't want this to become an overbearing job when you're trying to make these habits become part of what you do daily. No one wants to do what they don't want to do. If I hated doing this, I wouldn't do it no more. So again, rest and relaxation, put that as far as a habit. I'm going to take some me time. Today's for Ulysses. When I'm done recording, I'm going to kick my feet up. I'm going to go watch a movie. I'm going to Netflix and chill with myself. It's okay to be alone. So again, you could go back and forth, look at these 7 habits that helped me change my life and others that have told me about them. Or you could add to it. Or you could tell some of the other listeners, what's some habits that you've changed that make you a better person or to help you advance more in your life? I just want to discuss 7 habits that help me and my mental state, helping me change my life and reach my goals. Again, this is Dr. Ulysses Jackson, Mental Health Mondays. Thanks for tuning in. And make sure you hit that like and subscribe button.